Emergency rooms have become much more crowded in recent years. When I practiced emergency medicine a number of years ago, practiced for approximately 10 years in Illinois and again in California, emergency rooms were basically at that time the entrance point for patients to come into the hospital. Many of them did not have doctors, came in with various types of problems of either walk-ins or through ambulances. In more recent years, the emergency rooms have become very overcrowded, and one of the biggest problems in emergency rooms at this point is waiting time, either to be seen initially or after being seen by a physician, waiting for a bed in the hospital, and problems that occur because the patient's underlying medical problem isn't subject to the same type of waiting that the system is subject to at this point. And so people will deteriorate, their condition will get worse in front of doctors in the emergency room simply because once they've been seen by an emergency room physician, evaluated and determined they needed admission to the hospital, they're then put in the hallway where they wait for a bed in the intensive care unit. So we see a lot more problems these days in emergency rooms due specifically to the problem of overcrowding, and that has created a tremendous strain on the hospitals, and it's also very difficult for patients who go to emergency rooms to get the kind of adequate treatment that they deserve.